It's such an honor to work for Dr. Moses. He is just so intelligent and so funny, and the only other word that I could say about him is his integrity. So we have a really, really good time, but we work very, very hard. So doctors, you need to include all of your team members because you cannot do this alone. So I recommend that you look at the strong points of every one of your team members and redistribute their duties. Evaluate their strengths and their weaknesses, and the team members need your time. They need the education, they need time to do the extra duties that you will ask them to do, and they need tools such as business cards, email addresses, websites, computer. Team members, be on the lookout for sleep patients, and if you do, your practice will explode. We already have a group of patients coming into our practice that we see every day. Every 6 months we see the same people. If you are observant and you look at them in a different light, you might notice a sleep problem. So look at your medical history review. If they are taking new medications, they might have a sleep problem. All of a sudden somebody says, oh yeah, I just started taking blood pressure medication. Why? Start asking questions. Look for abfractions. Look for that battered uvula. You might notice a sleep problem. Oh, headaches? Oh, okay, let's talk about headaches. Is it a morning headache because you're not getting enough oxygen in the night? When you're looking at your tissue, your soft tissue, when you're doing your oral cancer evaluation, go ahead and look at everything in a different light. Your soft tissue exam, you may notice some things. Dental examination, just like Dr. Moses already told us, grinding, clenching, abfractions, those things are all a point that would make you start asking some other questions, initiate another conversation. If you see a panoramic x-ray that looks like this, ask some questions. This person is sick. This person has multiple diseases and probably has a sleep disorder. So ask questions like, do you snore? Has anyone accused you of snoring? Do you wake up in the night with a gasp for breath? Do you feel refreshed in the morning? How many times do you wake up in the night? Are you tired in the daytime? Headaches, we just talked about that. Listen to what your patient has to say because they have a story to tell you. And if you do find that you have a patient with a problem, introduce your patient to one of our best friends. Little red hot number, the Brave-On Metabite. This Metabite is so cool. I have 4-year-olds that go to sleep with a Metabite. I tell them, hey, guess what? You get to sleep, you get to dress up like a spaceman. And they wear their Metabite. Patients love the information that you get off the Metabite. We love the cost because it's so reasonable. It's a battery, big deal, and a cannula. Your patients will be very, very grateful that you found something out or confirmed that they have no problem. It's a screener. Now, Jan, yesterday, did you know that you had possible situation in your carotid artery? No? Okay, so if you show that to a patient, we're not diagnosing. We just say, you know what, this is a concern to me. This is what we see. It's right in front of our eyes. Patients are very, very, very happy to know about things that we get from the Metabite. So in our practice, we have your general patients and then your sleep patients. So if you find that your patient has a problem, treat them as if they're a sleep patient. If you'd like, you can refer them to a sleep lab for a sleep study, or based on the software that Rick has designed on the Metabite, we can just go ahead and request a confirmation diagnosis from a sleep doctor in our state. You can go ahead and try to build relationships with the sleep centers in your town. And as Dr. Moses explained, if you don't refer to them, they're not going to play nice and refer back to you. If you do send your patient to a sleep lab, very, very important to educate your patient and let them know they have choices. So when we get a phone call in the office, I usually try to take that phone call and I try to get as much information from the patient as possible. And I write everything down. I have this little notebook. And my family and friends know that this notebook is always in my purse. It's at work with me. It comes home with me. I don't sleep with it, but it goes everywhere with me because if I get a phone call from a patient, I can write things down. I write and I write and I write and I write everything they tell me because I have a bad memory and because I will be interrupted And 10 minutes later, I won't remember everything that they said. So I write down their medications. I write down if they have tried CPAP. I write down who referred them to our office. And all of this information is a piece to their sleep puzzle. So during that phone conversation, I also explained to them about the treatment. In our office, our treatment consists of an examination, an ICAT tomogram, and oral appliance therapy if indicated. I tell the patient the fees, and I explain to them that Dr. Moses is not currently in network with any insurance companies because he's a dentist. And I tell them our office policy regarding insurance. I ask them if they're ready to make the appointment. If you don't ask that question, they will hang up without making that appointment. I also get their email address so that I can send them a follow-up email to reiterate what I said. Some patients ask me for the insurance code so they can call their insurance company and find out what is the fee, what does my insurance company cover. And so I have all of those. All of those documents are Word documents. They're on your memory stick. Take them, change them, make them appropriate for your office, however, whatever you'd like. This is just there to help you. So when you're talking to your patient for the first time, that's their first exposure to your office. So you want to be sure that you're welcoming and professional. This is this is a copy of one of the emails that we send, and again, it's on your memory stick. So when the patient is coming in, we ask them for their sleep study ahead of time if they've had one. Dr. Moses goes over that with a fine-tooth comb. I look up all the medications. We want to be familiar with our patient's situation. Do they have allergies? Have they had previous surgery, like have they had nasal surgery? Do they have any current illnesses? Any conditions? What's their medication? What type of sleep disorder have they been diagnosed with? Did they ever try a CPAP? Some patients will say, or their sleep study will say that they tried it for the second half of the night and they were unsuccessful. So you know that that patient walked out of that sleep lab with not having a CPAP. And if you're not familiar with things, go ahead and look it up. WebMD, Google Scholar, all of these types of places have great information. Take things from the internet, however, with a grain of salt. So we already said how to prepare for your initial appointment. And now the patient's walking in the door. Their Metabite has already been configured because Dr. Moses is probably going to want a baseline. Introduce yourself, get your intake forms, get your consent forms, again, all of that in the memory stick, and go ahead and review everything with your patient so all of your information is current. Ask your patient, may I have your permission to send letters to your treating physicians, and they should sign that form. I go ahead and take the images, and then Dr. Moses comes in the back. We take the blood pressure, and we start the examination. He reviews the ICAT with the patient just like he did with Jan's ICAT yesterday. Our patients know what's going on in their head. They see every single slide that Dr. Moses goes through, and they love that. And then during the examination, just like we did yesterday, I usually assist, document the findings. I ask the questions. He says the answers. And then he will make a recommendation. Is it for an oral appliance? And he'll show them the appliance and go through all of the questions that they have. So typically, the patient accepts treatment. We take the impressions, we take the bite, and then he goes away, and I teach them how to use the Metabite. Just like we did yesterday, I put the patient in front of the mirror so that they can see what's going on. And patients are tired. Patients have poor memories. These sleep patients, they're sick. So take your time. Sometimes it can be a little frustrating. Sometimes you have to repeat yourself. But just take your time and be very kind to sleep patients. To all patients, but definitely sleep patients. We have an encounter sheet at our office where we check off what we did in the back so the front knows what to charge. So we fill that out, and we arrange for the Metabite to come back the very next day. Then we send the case off to the lab for fabrication. While we're going over our ICAT exam with the patient, we can say to them, oh, well, you have a small airway. Well, small in comparison to what? This is an evaluation that we did. It's a foam board, just like the one that we have all over the place. And it shows large, small, and medium. We use Dentorum impression trays, especially for the lower. They have really nice lingual extension, and I'll pass these around for you. All of the information in the catalog page, unless they've changed it, is in your presentation. You can order from them, and we love those trays. So this is, again, putting the Metabite on your patient. We went over all of this last night. You can go ahead and review this on your own if you'd like. The tips for using the Metabite, that's in your memory stick, and it's also in your bag that you used last night when you were putting your Metabite on. So when the Metabite comes back, we just go ahead and download the data. We used to have to remove bad data, but now we don't have to do that because 7.0 software is awesome. It figures out when the patient went to bed, when the patient got up. It gets rid of any little dropouts of the oxygen information, and we create the report. I usually try to show the report to Dr. Moses before the patient returns and to discuss our findings with him. Then it's time to write the letters. The letters are super important. There is software out there that will do the letters for you, and I'll show you that in a minute. But the letters are your findings of this entire examination and experience with your patient. And this is the best way to communicate with the other doctors who they see, whether it's OB-GYN, whether it's chiropractor, whoever it is. Give these doctors the information that you have, and they'll say, this Dr. Moses character, he kind of might know what he's doing. Components of the letter. Thank the doctor if this was a referral patient. Thank that doctor profusely for the referral. We give the statistics about the patient, their age, their weight, their height, etc. Summarize the full night PSG that was sent to us prior to their appointment so that that physician knows what we were looking at. Add a personal touch, a quote from the patient or their chief complaint. You know, some of these patients, the complaint, they have no complaints. They're getting kicked in the leg all night by their spouse or their bed partner because they're snoring so loud. That's their complaint. But other patients, we had a woman who came into our office and she said, I'm gaining weight. I think it's because I eat all the way to work. What do you mean? Well, because I have to suck on a lollipop or eat pretzels, because if I don't, I fall asleep at the wheel. So those kinds of things are important to note, and that's a nice quote. Then the patient knows that you listened to what they had to say. We are very thorough with our medical history in our letters, sleep disorder symptoms, examination findings, findings from the images, what Dr. Moses recommended, our Metabite report, our prognosis, and then repeat the thank you. There are several templates in your folder. I don't need to go through them, but on this slide, I'd just like to let you know that if I see something on the oral examination, I will highlight this in yellow so that the doctor, they don't really take the time to read maybe every word, so I kind of help them along. Again, all of the components to the letter. At the bottom of the letter, I will go ahead and add the little, I have sometimes little footnotes, and then I'll explain what the Brabon Metabite does and what the Moses appliance does. The Moses appliance, that's our macro for Moses. Actually, that's in your folder, and that's one of the components of what goes off to the insurance company. So now the patient's going to come back, they're going to get their oral appliance. We're going to go over their Metabite report with them. We're going to teach them how to care for their appliance. And you're going to want to know how to care for your appliance when you get it tonight. So everybody will get 3 packages of Cleanite. That's a trial package. Cleanite is the recommended appliance cleaner. Dr. Moses likes this one the best. It's difficult to find in our neck of the woods, but maybe in different states it'll be easier for you, or you can order it off online. This 3-minute Polident, not such a bad choice either. Okay, so soak your oral appliance for whatever the package says. Take it out, rinse it, and dry it, and store it in the case dry. Now, we recommend cleaning every day. We also recommend storing it dry. We recommend that you be careful that you don't drop it because it's hard plastic and it can crack. And we recommend that you bite on your back teeth in the morning, and Dr. Moses will go into that in further detail later. And we also recommend that you clean your teeth properly before you put your oral appliance in. I always tell my patient, it's probably not a good idea to eat an Oreo cookie and then put your Moses appliance in and go to bed. And I think they get the point with that because that's a pretty extreme, kind of a almost disgusting way to say it. So on the day that the appliance is delivered, we go over the Metabite report, always give the patient a copy, and I have a goodie bag, so that's the first thing that goes in the goodie bag. We always give the patient our lip balm so that when they're putting their appliance in and out, we don't stretch their lips too much. That's something that goes in to their goodie bag as well. I help while we deliver the appliance, and I usually don't really have to do much because the appliances are made so beautifully, they just snap in, and so I just kind of sit there. If we do have to use any kind of a indicator to remove some sort of a spot, we use the occlude, we use the green, and we use a ProfiJet to remove it. That's just a little side tip, kind of helps kind of quickly take that off. And then Dr. Moses will go over the exercises with the patient. We give them any post-op instructions, such as if your Moses appliance hurts soft tissue, please return as soon as possible. That has to be taken care of. If your teeth ache just a little bit, please take maybe your favorite over-the-counter pain reliever just for a day or two, and you will get used to it. So differentiation on that. If it's soft tissue, that will not go away. That needs to be just like when you guys do your dentures or whatever. Okay, then we recommend that we're going to do a follow-up study after 3 weeks. We're going to let all this tissue heal, let this inflammation go away, make sure our patient is adjusted and used to their oral appliance, and then we're going to retest them. And patients love these Metabite studies. So I have all of this stuff in my goodie bag. So this is your internal marketing. We have hats that say, Dr. Snore Stop. Our new hat says, Snoreless in Chicago. Our information with our cleaning instructions, it's a really good thing to give this to them so that they can have that because they forget. And then the instructions for their exercises that Dr. Moses will go over, these are all in your folder, and we'll go over them tonight when you guys get your oral appliances. So that's a nice internal marketing. They leave with your name all over the place. Now, when they come back after their next Metabite, be sure you remind them to bring their appliance. For some reason, patients think that it's not important, but that's very important. So say their appointment with Dr. Moses is scheduled on Tuesday. We get them their Metabite on Monday. They drive right past Sears Tower. We run out. We throw it in their car, and off they go. They sleep with it, come back the next day, and we go ahead and do our download just like we did before. So Dr. Moses will go over and compare the two Metabite studies, and sometimes he will recommend an appliance adjustment, advancement a little bit. Sometimes he'll recommend a nasal spray, or maybe he'll recommend breathe right strips, or a water pillow, or a referral to a specialist. So I just follow up with whatever he says. He likes to recommend this water pillow, and we can explain that a little bit later on, but we want the patient to have their head and their spinal column in the same line. And when you're sleeping on your side, the water is filled up so that it does just that. If you roll over on your back, it might be a little bit too full, it might be a little bit uncomfortable, so it encourages side sleeping. We do have these for our patients to purchase. We sell them just for what we buy them. It's just a convenience for them that they don't have to order it. All right, so now we have completed treatment. The patient has reached maximum medical improvement. We can do nothing else with them. So we have a separate recall system, and we recommend that they go back to their physician who referred them. we recommend, we think it's a very, very important thing, part of the treatment, is to get a follow-up PSG, full night PSG with their Moses appliance in. And so that's always told to the patient as they're leaving. We recommend that they come back and see us twice a year. We professionally clean their appliance. We look at it to be sure there are no cracks, that nothing is wrong. And if patients, some patients request another Metabite study. Dr. Moses prefers to do a Metabite study every year for sure. And our follow-up letter. These follow-up letters, this is my favorite part. This is the favorite part of my job. I love follow-up letters. So I get crazy with the tables, but I love the subjective comparison. She was snoring very loud. Now she's not snoring. She was waking up. Now she's not. Significant depression, not as intense. So those are all subjective. And then I put the objective, the baseline, and then our 3 weeks, and then our whatever, 3 consecutive. And send all of this off to your physicians who you already sent your letter to and say, okay, this is what we did. Now they really think that you know what you're doing. So this is awesome. And some of these templates are in our memory stick. Here's another follow-up letter, different kind of table. I highlighted the AHI. I highlighted the supine AHI. Wow, look at that. Isn't that great that we could do that with a Moses appliance? Look at the blood pressure. How about that? This was the full night PSG from the university or hospital, and I thought that it correlated nicely with the Metabite, so I thought this was a great way to show that physician that, our Metabite is not a toy. It is for real. It measures. And this is 73, 72 to 5.7. This woman loves Dr. Moses. All right, so here's another good one. Look at that, 20.8, 0.6, supine. And this patient slept 77% of the night, the first study in the supine, and 71 in the second study. So that's comparing apples to apples in my book. So I wanted to be sure that you saw that and be sure the doctor sees that. So look at that, 24 down to 7. Wow. Okay, so we have a database of our referring doctors and our copied doctors. Copied doctors are whoever we send the letter to, the other 4 physicians involved in the patient's care. And the referring doctor is whoever sent them to our office. So I keep this baseline, or this database, because I want these copied doctors, after like the 3rd time or the 4th time that they get a letter from us, I want them to start referring patients to us. So that's the goal. And this is a Word document, and I just add to it whenever I write letters. We keep a log of our sleep patients so we can look at it, again, at a glance. It's, you can probably figure something out with your practice management system, but I just keep a Word document. And it's important for marketing, for insurance, if we want to go back and double check something. Okay, so our insurance is just in our office. This is the way we do it. We explain what out-of-network means. Out-of-network for insurance companies means you're out of network. Simple as that. Our policy for our patients is that they pay us and the insurance reimburses them. Medical insurance carriers have numerous plans and everything varies from state to state. So if you hear something today from myself or from Jordan or from whoever, just double check that it's correct information in your state. I encourage patients to take responsibility for their health and for their insurance and say that, you know what, that's a contract between you, your employer, your insurance company, and kind of put the illness on them. Some insurance companies have exclusions. Some insurance companies like pre-certification. This is the claim form that they're using right now. However, as of January 2014, every file will have to be electronic. So this is what the claim form looks like. This is where you can get it. And we include the diagnosis code, copy of the full night PSG, description of the Moses oral appliance, and a letter from the physician stating that this treatment is necessary. CPAP intolerance, if it's applicable, medical necessity, recommendation for an oral appliance. And we're finding that in our office, we're getting paid very, very nicely for our treatment. The reason that we're getting paid very nicely is because we've been doing this for a long time, and because Dr. Moses' number or whatever, however, and he'll explain it better, insurance companies now know us. So don't be discouraged in the beginning if you have to send in further documentation. It does happen that, I guess they'll figure you out, right, Jordan? Okay. So the ICD code is the diagnosis code. We use the obstructive sleep apnea code if it's indicated. And then the procedure codes, all in your memory stick. This is my encounter form that I was telling you about. So, you know, you have to write chart notes and everything. This is nice so that the front desk doesn't lose the treatment. So we just fill out the diagnosis in the back, we fill out what we did, and then the front desk knows how to charge. This is one program, Dental Writer. Actually, Henry Schein is now distributor of the Moses appliance. Sleep Complete is the umbrella, and Dental Writer is one of the other companies. They're the software company. So now we're going to talk just for a little second quickly about marketing. It's a sprint. I mean, it's not a sprint. It's long distance running. Every patient is an opportunity. Every patient. So you know your practice, the demographics of your practice. Are they men? Are they women? Are they children? Are they elderly? Young professionals? Middle-aged family people? Kind of try to figure out what's going on in your practice. Internal marketing. Every patient who leaves your office should know what added value services you do. Do you do sleep? Do you do TMD? Do you do Zoom? You know, do you do orthodontics? Do you do invisible orthodontics? Do you take any kind of financing? Most importantly, do you do treatment of snoring and sleep apnea? And do you do home sleep testing? Whose responsibility? The entire team. Continuity versus confusion. If a patient asks a question of someone in your staff, it's a good idea that that staff member either know the answer or know how to find the answer so that your patients are not confused. Again, we talked about our conversation starter and what we need for each team member. We need business cards for the team members, brochures for your office. And I had some brochures in the other room. Dr. Moses did 2 great pamphlets. One was on snoring and sleep apnea. One was on snoring, one was on sleep apnea. And then we had some booklets that we send out to physicians, and those were in the other room as well. I can get a couple of those and bring them back up into the room later on in the day. If anybody would like those booklets, I have those on Publisher, and so I can just send the booklet to you, I can email it to you, and you can make it appropriate to your office. We have demo samples of the Moses appliance all over. Personalized toothbrush, goodie bag, lip balm, caps, hand sanitizer, like Rick has for Brabon, great hand sanitizer, mugs. So personalize anything you want as long as they leave with something. Your team members may want email addresses, post-op sheets that are personalized, and we try to get email addresses from all of our patients. You might want to write a newsletter, you might want to have a website, and you might want to have a landing page, you might want to have a blog. Show interest in your patient, ask them questions, take time to find out about them. Where do they live? Are they married? Do they have kids? Are they students? What do they do for a living? What are their interests or vacations? You might have something very, very much in common with these people. Are they shift workers? If so, they might have a sleep disorder that you could help them with. Is it a new mom? She's tired just because their baby's not sleeping. People who do excessive business travel and travel through time zones, they sometimes have a little problem. Also, if they are extensive business travelers and they're a CPAP user, you might want to ask them if they'd be interested in oral appliance because it's easy to travel with. Find out if they're a student. Students have lousy hours. So you want to discuss the sleep patterns and their hygiene with your patient. Offer that home sleep test. Don't be afraid to offer that. Tell people, you know, we have this home sleep tester, the Brabon Metabite. It's great. Offer it to them. It shows that you care, and it's a lot of bang for your buck. There are other programs to help. The Henry Schein has the Total Health, and this is, it actually kind of correlates periodontal disease, diabetes, heart disease to the whole body, just like Dr. Osler and Dr. Milligan do. And so we do have that program in our office. Patients visit the dentist more often than they visit the doctor. So again, like Dr. Moses said, we have more face time. They have great little brochures that you can pass to patients. They have a checklist that your hygienist or your assistants can ask questions and go into that. There's a chair side. This is laminated, and you can have it right at your chair side and explain to them the correlation between periodontal disease, oral cancer, sleep problems, heart disease. Total health for your office means that you care about your patients, basically. You reinforce the fact that they need to come to you twice a year. Okay, so external marketing, websites, who are you? A great business website doesn't sell. Instead, it shows patients why they should do business with you and not your competitors. A great website is interactive, call to action. A blog is, a lot of doctors they put a little comment each day, and you can do that too if you want. There are some suggestions of what to put on your blog on this PowerPoint, and you can look at those on your own time. Debbie Ryan is a person with prescriptive marketing. She actually has an entire program where she will set up almost like a town hall meeting of patients who are not CPAP compliant or cannot tolerate CPAP, and she will explain to them alternatives. And she does that for doctors. If you're interested in her program, let me know. Customer service. Customer service is very important because without our patients, we wouldn't have a business. Patients are the lifeblood to any business, and because of that, we need to provide them with service that will create loyalty, repeat business, and recommend. We want them. We want these people to recommend us to everybody that they know, everybody in the Sears Tower. You can do your external marketing to patients, professionals, other dentists. Let everyone know the equipment you have. Let them know you have an iCat, or let them know that you have a Metabite. Give your other medical friends a demo of the Moses. Teresa told me yesterday that they can put your office logo right next to the Moses logo, and then if it's at a sleep center, the doctor there will remember, this is a Moses appliance, and I can get it from Dr. So-and-so. So that's a great marketing tool for you. Teresa will be back tomorrow if anybody wants to order any of those. Keep other patients in the loop of what you've done with their patients and what accomplishments you've made. Brand yourself in the community. Direct mailings, all of these suggestions are great. Church bulletins, welcome wagons. Contact your newspapers and tell them what you're doing. And auxiliaries, what can you do in marketing? Well, you can talk to the professionals, or you can talk to the patients via any of these modalities. Take your show on the road. Go visit people. Go out there and visit people. Dr. Moses, because of his affiliation with the universities, does a lot of grand round lectures. And we've been to the sleep centers. We've done lunch and learns at the pediatrician's office and at the GP's office. And then you have a meet and greet session with these doctors. And all of these things are valuable. Everybody learns about you. As far as educating the patients, in your community you might have library events, or you might have a golf outing. Sponsor a prize or something like that at the Rotary Club so that people get to know who you are and what you're doing. So the website is important. Joining some of the professional organizations that deal with sleep, that's important. You might want to build a business Facebook page. Subscribe to the professional journals. Curriculum vitae. If you have a curriculum vitae, be sure that you update it. When we're planning a lunch and learn, it's just logical. You call the office, you identify which office you want to go to, and you don't stop calling them until you get a yes. Ask them how many people they have. Ask them what if they have, like a screen or a projector. If not, make up some foam boards. We use those as flashcards, and go visit your friends, your new friends out in the community. The day before your lunch and learn, you just want to call and confirm everything. This is a little list of what to pack. We usually bring a little gift for the patient or for the contact person who actually lets us in the front door. Be sure you bring tip money to tip the delivery person, order your lunch, and whatever you need, whatever AV things you need. So overall, it's just important to be creative, very important. Be positive and professional. Use the resources at our office. We already explained how Dr. Moses loves to talk to people on the phone. Rick answers his phone, and if he doesn't answer, you leave a message, he will call you back, and our friends at Modern as well. Use the internet, and please share all of your information with us. This is just a springboard for you. We like to hear how you're doing. We like to learn from your experiences as well.